Welcome to 90 Day Dental Day 22. So we're starting a new section today for the next few days on colour matching photography in dentistry, and we're going to start with an introduction to photography by Billal Arshad, who's given this talk numerous times and it's always been an absolute cracker. Take it away, Billal.
Hey everybody, I'm Billal Arshad and here is my 10 minutes on dental photography with the 90 Day Dental. Okay, so let's begin. One of the first things that I want to talk or discuss is why is photography important? And there are a number of uses for dental photography, clinical documentation being the first. So when we take our initial photographs, one of the things that we want to see is that we have a good set of portrait photographs, both with the patient resting and with the patient smiling as well. And then we have good quality intraoral photographs as well. And the purpose of these photographs is for us to be able to either document, to formulate a treatment plan, to present, etc., etc. Okay. However, if the photographs aren't of a high standard, it becomes very difficult to do these things. So a good set of portrait photographs, intraoral, with the lips out of the way, retracted, possibly to see the teeth, and also some photographs of the actual teeth on the outside as well. Having a good quality mirror allows us to see intraoral as well with some occlusal shots. Another reason why we may use dental photography is communication, and that communication may be with patients. Sometimes it's very difficult for a patient to understand what is going on in their mouth. So taking a quick photograph allows them to see, and it's a lot easier for them to visualize what you are trying to say to them. Again, a good quality photograph allows them to see this better. Alternatively, you can communicate with your lab as well. So sometimes we pick up the phone call and we call our lab and we tell them that we're not happy with a certain result. But taking a good quality photograph, documenting it and annotating it on a PowerPoint or keynote presentation and sending it over to our technician goes a long way. It also improves the efficacy of your treatment and improves the outcome of your result as well. Another reason why we might use dental photography today is portfolios and self-assessment, and this is actually done a lot more nowadays, and there's nothing worse than seeing a portfolio which has poor quality photographs. But the biggest thing is, as you can see here with portfolios, is that you have consistent photography all the way across, whether that's normal restorative photography or surgical photography. The key is that you have your framing and your positioning correct. Once you have your framing and positioning correct, then everything kind of flows into place. Also, it improves the portfolio, the quality of your portfolios, and also, when you're actually looking at your own work, you actually realize how good or bad your work actually is. Photography is also brilliant for marketing. There's nothing worse than going online on websites and seeing dentists market specific before and afters, but the quality of the photographs is not great. So as you can see here, we have a picture of a patient who has had tooth whitening, and if we ensure that the end result after we've had some whitening, that the photograph is taken in the same frame and the same position, then without doing anything fancy, we can just crop the two pictures in half and we can relay them like that. And it goes a long way with regards to that. It has more of a wow factor rather than just showing simple before and afters. What about the actual camera? Okay, so there's lots of cameras out there. Canon and Nikon seem to be the main sets of cameras that we're using on a day-to-day basis. For me personally, I'm a Nikon man, and if you're going for a cropped sensor, then you're looking at a D7500, or something similar for a Canon would be a 70D. For a full frame, if you're going for a Nikon, then a D850 would be your option. What about the lens? The lens is probably the most important part. Ensuring that you have a good quality lens, anywhere in the range of 85 to 105 millimeters. You need to ensure that it's a macro fixed lens. You have the Canon equivalents and the Nikon equivalents. A Sigma is a good option, which is versatile for both. But my personal preference is the Tamron 90mm fixed macro lens. You can get 60mm lenses. I find that you have to get too close to the patient for when you're doing intraoral shots, and that's a big problem when you're using twin flash photography, because it hides. Because you get so close to the actual patient, it kind of hides the light. So my personal preference is always going for an 85 all the way up to 105mm, but a 90mm Tamron is versatile with both Canon and Nikon, and that would be the lens that I would go for. With regards to flashes, you have ring flashes, which are great. They give you a lot of direct light. You have your Sigma lens, Sigma flash, your Canon flash, Nissan flash. You have your Metz wireless flash, which is great, but the power on it is great for most things, but not for other things. And then you have a cheaper Yongnuo or a Kenro, which are equivalents of the other brands. A lot cheaper, however, they don't last as long. So if you're going for a good quality, solid ring flash, then a Sigma is a wired. It's brilliant, or the wireless would be the Metz wireless flash. Personal preference is using twin flash photography, so this is not speed lights that we're talking about, but if we're talking about dedicated twin flash photography, then the Nikon wireless has a dedicated twin flash system. Alternatively, more recently, you can opt to purchase the Mikey twin flash, which has a Canon and Nikon equivalent. So when you are purchasing that flash, you need to ensure that the flash is compatible with your camera, so make sure you choose a Canon or a Nikon equivalent. One of the reasons, going back to the cameras, is that you need to ensure that the camera has wireless capability. So just a very quick show. So here we see a lovely smile of the patient with some no treatment on the actual teeth. You see here a ring flash photograph, again the same patient taken with twin flash, and you can see that with the twin flash itself, it pops the picture out a lot more. And then you can use some optional diffusers or bouncers, which improve the quality of the light. It softens the light and improves the image as well. The problem is with using bouncers and diffusers, if used incorrectly, they can be used to hide a lot of things as well. So although they may work in your favor, they can sometimes mask a lot of things and make things appear as they aren't in real life. However, that's something like a setup there where you have a bracket with your camera and you have two twin flash system or a speedlight system with some bouncers on there. What about the actual settings? So talking about the general standard settings, then we prefer to have an electronic through the lens method for our flash system. If you're using diffusers or bouncers, then you might prefer to use a manual flash system. Metering would be center weighted. The mode would be manual. Focus is, I always prefer to have it on manual, and you can set the lens ratio, which I'll come on to. The ISO would be 200, the white balance would be flash, and the shutter speed would be 1 to 200. What about the actual aperture, which gives us the depth of field, so f32, and you can't go wrong for intraoral and extraoral close-up photography. And also with the actual lens, you can lock the lens on a 1:3 or a 1:4 ratio or a 1:2 ratio, and you can get the following photographs. When you're going for portrait, I prefer to use an aperture of f9 to 11 and either set the lens to auto setting or choose a spot on the floor and go back to it every time. Okay. With regards to retractors, there's lots of retractors out there. My personal preference is using these Columbia metal retractors, which have two different sizes, and they're great because when you're using things like contrasters to give yourself a black background, they just work very, very well. They're also a lot cheaper than the other retractors. They autoclave well. You just need to know how to use them correctly. And using a black contraster, either silicon or metal, the problem with metal is that it can sometimes show up scratches, but a silicon one tends to work great, and it gives you some beautiful intraoral photography, as you can see there. And that is on a 1:2 lens ratio. The other option is you can use mobile dental photography, something developed by a guy called Louis Hardin, Style Italiano. And you can see here a long time ago I used a Samsung Note 9, the same teeth with a general flash that you have. The photography is improved a lot more, and then using the MDP, you can see the photograph looks a lot better. and then even more using the MDP with some diffusers, and the photograph works very, very well. Okay, so thank you very much. I know we only have 10 minutes and we can't cover everything, but please do go on academyfordentists.com, where you can come onto one of our courses and we can spend a whole day teaching you dental photography. Take care. Thank you very much.
It's so inspiring to see so many dentists taking an interest in photography and bringing it into the clinical and really helping to push the boundaries. Taking it a step further tomorrow with digital smile design and really taking that forward with Elaine Halley. See you then.